Hi, today we're going to be talking about managing COVID-19 in general practice. But first, we gotta be clear about what is coronavirus. Actually, it's a large family of a novel enveloped RNA beta coronaviruses that usually cause mild to moderate upper respiratory tract illnesses in humans. Hundreds of different coronaviruses have been identified. 3 of them being extremely severe, and the 7th strain, COVID-19, emerging in China in December 2019. When a number of patients were hospitalized with pneumonia in Wuhan. Then, from the 18th to the 29th, 5 cases with acute respiratory distress syndrome, and on January 2nd of 2020, 41 confirmed cases of COVID-19. Just 20 days later, the number of cases had increased rapidly by hundreds in 25 provinces of China. By the end of January, many of them started getting confirmed in many other countries, from Taiwan and Nepal to Australia and Finland, and by the end of March, it was all over the world in more than 180 countries. Ways of transmission. Current evidence shows that COVID-19 virus is transmitted through respiratory droplets and contact routes. Each infected individual will on average transmit the infection from 2 to 3 others. However, some may be responsible for a large number of secondary infections. The main symptoms are high temperatures, continuous coughs, and shortness of breath, although there are also some red flags, such as severe breathlessness, chest pain, and change in color of the skin, such as blue lips or face. Meanwhile, children generally show mild cold-like symptoms, including fever, runny nose, vomiting, and diarrhea. Now, we should all follow social distancing, although the most vulnerable individuals are anyone over 70, pregnant women, and anyone with medical conditions, especially the ones with respiratory and cardiovascular diseases and hypertension. While isolating, we should have food, medication, and supplies delivered home, avoid going out and using public transport, double bag and seal all waste, cover coughs and sneezes, stay hydrated, and wash your hands with soap and water for 20 seconds regularly or use a hand sanitizer. By the way, this last one is actually the easiest way to prevent COVID-19, but it's really important to do it properly. What is also very important is to have a routine care during the pandemic, including maintaining physical activity, which matters for both our physical and mental health. At least 75 minutes of vigorous activity or 150 minutes of moderate intensity activity, strengthening exercises at least 2 days per week, and balanced exercises particularly for older adults. Some ways for looking after yourself during the pandemic are to talk to your friends and family and stay connected with them. Stay well hydrated, eat healthy, and take your time to enjoy your meals. Avoid watching, reading, or listening to the news that could cause you to feel anxious or distressed. Take short breaks during the day, and to follow an online exercise class. Since the arrival of COVID-19 to Peru, the government has been taking important measures to prevent the spread of the virus. Some of them being implemented mandatory social distancing and curfew and the use of masks, organizing the days people could go out by their gender, monetary subsidies, and the creation of digital platforms to facilitate homeschooling. Also sending health professionals and medical equipment to many provinces and distributing thousands of masks in many regions to protect the health personnel. Finally, here are some common questions about COVID-19. Will warm weather slow the spread? You know, many viruses wax and wane with the seasons, and coronavirus generally cause respiratory illness in the winter, but it is possible that it might also tail off and continue spreading and cause severe illnesses during the warmer months. Another major concern is that if it returns next winter at the same time as the influenza peak, it could overwhelm the healthcare system and cause even more deaths. Can patients get reinfected? You see, the majority of those who develop the infection and recover will develop immunoglobulins M and G, antibodies against the virus. This should work as protection and provide long-term immunity. On current evidence, it doesn't appear to be capable of mutating very quickly, so reinfection is likely to be very uncommon. Let's just remember that despite this being a hard and painful time, we should try to reflect on our actions and start taking care of ourselves again. We should try to heal and fix family troubles. Let's do all the things that we said we didn't have time for. Let's spend time together and share. Let's be kind and loving to one another and the world.